Good morning, everyone. Well, we conducted a household telephone survey, and we did this in partnership with Kent State University. We utilized the expertise of Kent State University in terms of their data collection abilities and data management. And as the survey data were completed, they transmitted that data to ODATIS, and our Division of Planning Outcomes and Research has been conducting analyses and developing reports, and many of the research team actually is here with us this morning. The survey consisted of 3,600 completed surveys of Ohioans who were 18 years of age or older. And in consultation with the Ohio Casino Control Commission, the sampling strategy included oversampling of 600 adults in each of the 4 county areas where the casinos were to operate: Cuyahoga, Lucas, Franklin, and Hamilton counties. And in addition to that oversampling of 600 in each of those 4 areas, we also had a statewide sample of 1,200 individuals, adding up to 3,600. This enables us to establish, as you've heard earlier, the baseline information for the casino areas as well as the state in terms of prevalence rates. We used a multi-stage random area probability sample. That simply means that step 1, stage 1, involved identifying zip codes, and stage 2, identifying the phone numbers within those zip codes. We made sure that the surveys, especially with Cuyahoga and Lucas, the casino areas that opened first, were required prior to the casino's opening. The survey questions were actually derived from 2 separate instruments. Our primary survey instrument was based on the Canadian Problem Gambling Index. We also added a couple of items from the Minnesota Institute of Public Health's Community Readiness Survey. That survey gave us several items related to community attitudes and perceptions of gambling that we thought would be particularly useful for our prevention planning. We selected the Canadian Problem Gambling Index as our primary instrument because it demonstrated good reliability and validity, and seemed to include all the types of information that ODATIS and its partners were most concerned about in terms of data collection. Had a host of demographic types of data. We're also able to look at the type and frequency of gambling and the amount wagered. We can look, for example, as you can see here, on lottery versus casino versus other types of gambling. Other being, for example, bingo and day trading, horse racing, raffles, and so forth. And then to the extent that we also want to make sure that our results could be beneficial to prevention as well as treatment, we wanted to make sure that we selected an instrument that would provide that information. This instrument actually provides us with a picture of 5 different categories of respondents. People who don't gamble, non-problem gamblers, gamblers who are at low risk for problems, moderate risk problem gambling, and then problem gambling. We also are able to collect data on various correlates of gambling. Family correlates such as a history of substance abuse or gambling problems in the family, and individual correlates such as problems with drugs and alcohol, physical emotional distress, and depression. Now, the data that we've presented in this initial report is weighted data. As often happens with household telephone surveys, in our sample we tend to get an overrepresentation of older adults, of females, and an underrepresentation of minorities other than white or Caucasian. So we weighted the data on age, race, and gender to better approximate the population under concern. All right, so what were the key findings? Well, in terms of prevalence estimates for at-risk and problem gambling, the prevalence of combined at-risk, that's low risk, moderate risk, and problem gambling in Ohio, is estimated to be at 2.8%, which equates it to approximately 246,000 Ohioans, in the target population of 8.8 million Ohioans aged 18 or over. Those prevalence figures are fairly consistent with other similar problem gambling surveys. We also have, you can see here on the end, our county clusters. This is where we did our oversampling. And you can see here that Cuyahoga, Lucas, and Franklin counties, while they have relatively low problem gambling estimates of 0.1% or 0.2%, Hamilton County seems to be an outlier with an estimate of 1.4% having problem gambling. We're not sure why that is. One of our hypotheses is that it may be a proximity effect with existing casinos across the river in Kentucky and Indiana, but we have some more work to do to understand why. We also can take a look at the type and frequency of gambling. And here you can see we've broken out lottery, casino versus other gambling with level of risk or gambling status being no problem, low risk, moderate risk, or problem gambling. 8.2% of Ohioans who participate in casino gambling are estimated to have some degree of risk or problem gambling, compared to 4.8% for lottery and 5.1% for other gambling. That's a significant difference. Most likely folks that are currently engaged in casino gambling who are going out of state are probably a little bit more engaged with gambling behaviors, and hence we see that kind of finding. If we look at the lottery, based on the frequency of gambling, non-daily lottery tickets appear to have the edge in popularity, with 13.3% of Ohioans playing at least weekly, followed by instant scratch-off games. If we look at casino gambling, and again, we don't see a large frequency of gambling yet in the state, given that we have folks who are going to neighboring states. But right now, baseline type and frequency of casino gambling demonstrates that casino gambling overall is infrequent, with most gamblers reporting playing casino games between 1 to 5 times yearly or never. Slot machines or VLTs were most likely to be played compared to other casino games. In terms of the demographic findings, males were significantly more likely to have at-risk or problem gambling status than females. We also saw some interesting, significant relationships between problem gambling and at-risk gambling, along with age and race. Those tended to vary across the county clusters, although we did not observe any significant relationships at the state level. With regard to correlates of problem gambling, we were able to compare non-gamblers, gamblers who did not demonstrate a problem, and then grouping the at-risk and problem gamblers. And there we did see some significant relationships with regard to correlates of feeling seriously depressed, being under a doctor's care because of physical or emotional problems brought on by stress, the use of, or the urge to use drugs or medications to deal with painful situations, as well as a history of alcohol or drug problems. And so I think this gets back to some of Mr. Coleman's comments regarding co-occurring problems with gambling. Attitudes and perceptions. Well, the good news is that over 65% of respondents believe that prevention efforts can reduce gambling. The not so good news, the area that we're going to have to do some work on yet, is only about half of the respondents believe that the community is responsible for setting up prevention programs. About half of the respondents believe that gambling at a casino is more risky than buying lottery tickets or pull tabs, and less than a quarter of respondents believe that it was okay for high schools to sponsor casino nights for graduation and prom. So that's some data that our prevention division will be able to use as they move forward in developing prevention response to problem gambling. Now, in addition to the survey, we also have at ODANIS the Ohio Substance Abuse Monitoring Network, which is our ongoing monitoring and surveillance of drug trends. And one of the things that we added to the OSAM protocol every 6 months is to take a look at the relationship of drug abuse and problem gambling. So the OSAM network findings, this is not the survey, this is different. Based on 209 participants, these are users who are either recently coming into treatment programs or off the street. 209 participated in some type of gambling in the past 6 months. And of those 209 who participated in some form of gambling, 22.3% of gamblers reported using more alcohol and drugs when gambling. 19% of gamblers reported gambling more when using alcohol or other drugs. 8.4% of gamblers reported gambling to buy alcohol or other drugs. 5.6% of gamblers reported substituting gambling for AOD use. And then the prevalence of problem and pathological gambling with substance abuse disorder was found to be 15.4% for some problem gambling and 11.1% for probable pathological gambling. And when you think that 73% of those 209, about 73% of participants either did not participate in gambling or screened as not having a problem with the South Oaks gambling screening instrument. So those are pretty significant findings that really reinforce the notion that when we're looking at specific populations, unlike our survey, which was the general population of Ohio, when we're looking at specific populations, prevalence rates are going to be much higher. And with that, I'd like to introduce